Well, the Ontario Science Advisory Table is about to release their latest modelling in about an hour's time. The latest wastewater data shows the province may have already passed the peak of the sixth wave. So to talk more about what we may see and to break down what we do know, Infectious Diseases Physician Dr. Sumon Chakrabarti joins us live here on CB24 Live at noon. Good to see you, Dr. Chakrabarti. Hope you're doing well today.
Good to see you too.
How do you take a look at this wastewater data and the way the curves have gone here? We appear to be peaking. Is that your interpretation?
Yeah, it certainly looks like that. When I was looking at the water data that was released, I believe, yesterday in the evening, you can see this is a pattern that we're seeing in multiple regions. That's important. You don't want to just see it in one place. It's encouraging. This is consistent with kind of what we saw in previous years as well, when you see a late winter, early spring surge of respiratory viruses. So this is welcome news, and let's see. Hopefully this means that we're past the worst of it and on our way down.
You know, lately we've heard from Dr. Peter Uni, the head of the Science Advisory Table, talking about, he estimates that, on a daily basis, we're looking about 100 to maybe 125,000 cases, new cases of COVID-19 each day. Of course, we don't have accurate figures. These are sort of extrapolations based on that data. When you look at that and then you look at the hospitalizations, you look at the ICUs and things like that, how do you sort of put all of that into context? Because the hospitalizations don't seem to have jumped too significantly rapidly, while the cases have certainly skyrocketed.
Well, absolutely. It's hard to make extrapolations from the wastewater data. It's not meant to be translated into numbers. But that said, yeah, there's probably a lot of cases in the community. But absolutely, what we're seeing in the hospital is very different than what I saw, for example, a year ago. I'm sometimes seeing 90-year-olds who are coming in. They're requiring a little bit of oxygen, and then we can often send them home because they get better. So the disease that we're seeing now is different. Not to say that people aren't getting sick from this. They are. But the degree and the kind of proportion of what we were seeing, say, the third wave last year, it's nothing compared to what we're seeing right now, where the people are much less sick overall.
Dr. Moore was referring on Monday, Dr. Chakrabarti, about the idea of extending perhaps the mask mandate in busy public places like, public transit and places like that. Premier Doug Ford was just asked about that about 20 minutes ago, saying why is he in favor of doing that in terms of keeping masks on public transit, but not in classrooms? Do you see a difference in public transit versus classrooms? And if so, could you explain to our audience what that difference is?
Yeah, to be honest with you, I think that we have to kind of take a step back from masking and look, there's obviously masks have been part of our pandemic uniform for the past 2 years. But, I think what they're actually offering us is being oversold. Look what's happening right now, where we're probably reaching a peak and about to go down in the absence of any mask mandate. You see places that have mandated masks or have not mandated masks. And the comparisons, they essentially have the same type of epidemic curve. I think at this point in time, of course, especially a well-fitting mask that has been tested is something that can certainly protect the individual. But I think on the population level, the masks aren't doing as much as the heavy lifter, which is essentially the vaccine protection and also the therapeutics that we have. So I think that, to be honest with you, it can be lifted in all areas. I know this is not the opinion that many of my colleagues share, but I think when you look around the world, what's happened, especially places that have had the mask lifted for a long time, it hasn't made an appreciable change. And the big thing that we're seeing is a decrease in the severity due to widespread immunity.
Okay, that is interesting, because at the same news conference just about 20 minutes ago, the Premier was saying to people, if you're gathering perhaps with 15 people over this holiday weekend, plenty of different sort of religious gatherings taking place. He said, use a bit of common sense, mask up. Are you kind of saying maybe we don't necessarily need to mask up if we're, in a house with 15 people or so at a family gathering or a gathering of friends?
What I think is that if you feel comfortable, if the people that you're with want to mask up, I think that's definitely a thing that is a personal risk assessment and a choice. But I think that we have to start moving away from public health telling us what to do in our own homes, especially we're out of the emergency phase of this pandemic. Certainly people are still getting sick, but not nowhere near to the same extent as it was before. And the other thing that I want to mention as well is that when you look at this, is that what are we going to do every single time a holiday comes? Are we going to say that, we should be careful? I think this whole idea of telling people to constantly be careful, vigilant, that has an effect, and it can cause a significant negative impact, especially on mental health. I think right now, go and do what's comfortable in your holidays, be with your family and friends, and do with what you think is safe. And this is a lot is thanks to immunity, which is protecting us on the ground, both from the vaccine itself, as well as the large number of people who have gotten infected and have gotten immune from that as well.
Okay, Dr. Chakrabarti, always great to get your perspective. Thanks for joining us on Live at Noon today.
Thank you.